Hello.
Hi.
Hi, nice to see you again.
Nice to see you.
Well, coming back in to check your blood pressure after your lab tests. Hey, well, how's it going?
It's going okay, you know.
Yeah, just
Yeah,
okay?
Yeah. You know, kind of a rough week.
Okay.
But I've been taking my meds and doing what I'm supposed to do for the most part. So
You started the sertraline a couple months ago. How's your mood?
you know, some days are harder than others.
Okay. Overall, would you say improving, not improving, or getting worse?
Maybe like a little bit better.
Okay. All right. So maybe a little bit of improvement in your mood. Okay. How about any other symptoms? Sounds like you're having some leg swelling.
Yeah, my legs are swollen a little bit, and my feet, I noticed.
Okay.
So,
Is it painful?
a little bit.
Okay. Well, you've had a lot of pain earlier with your fibromyalgia.
Right. Sometimes it's hard to tell the difference.
We started you on a short course of the hydrocodone. Did that help at all?
Some.
Sometimes the hydrocodone makes people constipated. Have you had that problem?
No.
Okay, good. How's your diet been?
I mean, you know, sometimes you've known me for a while, you know, sometimes that's hard.
Yep, if I
A little bit
recall,
with the
you had a problem
salt.
with potato chips.
A little bit with the salt, and yeah,
Okay.
I'm trying to do better about it.
Yeah, well,
When I get
want...
stressed, I want to eat whatever I want to eat. I don't want to think about it.
Sure. I wonder if the swelling doesn't have to do with that. We can look into that a little bit more. Now, the nurse did your vital signs, and you don't have a fever, and your heart rate was 72, and that's normal. And your breathing was 16, and that's normal. And your oxygen level was 99%, and that's normal. But your blood pressure was 212 over 110, which is not normal.
That's pretty bad.
Yeah, that's pretty high.
Oh, okay.
That's pretty high. High enough that if we didn't get that under control in short order, that could cause problems.
Okay.
And you know, with blood pressure issues, there's always the risk of stroke or, over the long term, heart disease. And problems with your kidneys, problems with your eyes. So we should get that under control. And part of getting that under control will be adjusting your medicines, maybe.
Okay.
And then the other part is going to be some lifestyle issues that you're going to have to take charge of. Right?
Okay.
Okay.
That's kind of scary. Is there anything I need to do, like, right now, or?
Well, we'll recheck it in just a minute here.
Okay.
And then let's go over your meds. So you're taking the Lasix, right? And you're taking potassium. And the Lasix, if I recall, you were taking 40 milligrams a day. And the potassium was 20 milliequivalents per day. You've been taking that every single day without fail.
Yeah.
You're on the lovastatin. Okay. No increase in your aches and pains since you started the lovastatin?
Just like with my legs and feet.
With the swelling?
With the swelling.
All right. And the hydrocodone and sertraline we just talked about. Have you had any fevers or vomiting or trouble breathing, any other new symptoms?
No.
Okay. All right, good. Well, the first thing I want to do is recheck your blood pressure here.
Okay.
So let's do that.
Do I need to put my sweater up, or?
I think just as is would be fine.
Okay.
So I'm hoping it will have come down now that you've been sitting for a little bit. Well, we started out at 212 over 110, and right now you're 228 over 113.
Okay.
So we're going in the wrong direction.
Okay. What does that mean?
Well, it means that your blood pressure is poorly controlled and we need to do something about it. But it's so high right now that I'm not comfortable with you just going home.
Okay.
Okay. Why don't I do more of an exam,
Okay.
then we'll review your lab tests from yesterday.
Okay.
So take some deep breaths. So it looks like you're breathing comfortably. And your lungs are nice and clear. I don't hear any signs of fluid in the lungs, which can happen when the blood pressure gets too high. Let me listen to your heart. Normal rate and rhythm. And I don't hear any murmurs or other sounds, so that's good.
Mm-hmm.
Let me feel your pulses. Pulses are great in the wrist. You don't have any swelling or pain here.
No.
Is that right? How about your rest of your arms? No? Okay. Let's look at your feet. Quite a bit of swelling here. Clear up to the knee. I would call that 2+. Okay. Does this hurt? Is this painful? So this is tender swelling. Seems to be pretty equal on both sides, yeah? Okay. And how about back here in your calves? Does that hurt?
Yeah.
Your thighs hurt?
Just like maybe right here down.
Okay. All right. How about joint pain? Are you having any joint pain? Or is it mostly in the muscles?
Mostly the muscles.
Okay. As I recall, your fibromyalgia pain was also in the muscles up in your chest, your arms, your back. So that changed at all?
It's about the same, you know, maybe a little bit better.
Okay. All right. Well, let me check your reflexes here. You just relax your legs. Good. You've got normal reflexes at the knee, and your strength is good. You have normal sensation in the hands, the feet. Okay. And no vision changes. Let me look in your eyeballs.
Okay.
So on the right eye, I do see evidence of blood pressure changes. We call that AV nicking. And a little bit of edema. So the same kind of process that's happening in your legs is happening in your eyeballs because your blood pressure is so high.
Okay.
And let's see. Let's review your labs from yesterday. So your sodium was 138, that's normal. Potassium was 4.7. Chloride was 96. Bicarb was 24. Your BUN was 20. And your creatinine, which is your kidney function, was 1.6, which is a little bit high, and it's higher than it was last time you were here. It was 1.4 last time. Your sugar was 136, and your blood counts show your white cell count is 7.8. Your hemoglobin and hematocrit are 14 and 40. That's all normal. Your platelets are normal at 215. So I'm worried your blood pressure is affecting your kidneys.
Okay.
And I think your what was chronic renal insufficiency, so chronic renal disease from your blood pressure that we noticed a few months ago, is worsening now. And your blood pressure's worsening here.
Okay.
So this is what I'm worried about is something called hypertensive urgency, which is a problem where the blood pressure creeps up into a range where it can cause damage to organs in the body. And right now, the organs that I'm most worried about are your eyes and your kidneys. But if it goes on too long at such a high level, I worry you may be due for a stroke or a heart attack or problems with the lungs, etc. So I think we ought to get you over to the emergency department and get you some treatment for your blood pressure today.
Oh, today.
And if they can't get good control in the ER, they might need to admit you to the hospital.
Oh, okay.
Okay.
Okay. I mean, if that's what you tell me to do, I'll do it.
Yeah, I think we ought to do that.
Okay.
You okay to drive over to the ER?
Yeah.
I'll give them a call ahead of time and let them know you're coming. I want you to go straight there.
Okay.
Don't stop at McDonald's or anything.
Okay. I won't do that.
Don't collect $200.
Okay.
Okay?
Okay. All right. I'll go there.
Any questions?
No. So, should I come back? Like, see you again?
I'll have my nurse give you a call
Okay.
to schedule a follow-up appointment.
Okay.
But let's get you over to the ER first
Okay.
and sort of see what they want to do with you
Okay.
after your visit there.
All right. Sounds good.
All right,
Okay.
thanks.
Thank you.
You stay put for a minute and the nurse will come by.
Okay.
Nice to see you
Okay.
again.
Thank you, Doctor.
Hi, this is Dr. Hurwitz to speak with the ER physician, please. Hi, this is Dr. Hurwitz over at the Family Practice Clinic. Hi, Dr. Smith. So, I have Katie Johnson in the clinic here who comes in with hypertensive urgency. So this is a lady who's on Lasix and potassium, lovastatin, and she's on hydrocodone for fibromyalgia and sertraline. She came in today with a pressure of 212 over 110 initially. I rechecked her pressure in the office, and it was in the 220s over 110s. And I'm concerned about hypertensive urgency. She possibly emergency. So on her lab values a couple of months ago, her creatinine was 1.4. It's now 1.6, and I note some retinal edema and AV nicking on fundoscopy. So I'm worried she may be worsening from a hypertension standpoint. No chest pain, no dyspnea, lungs are clear. The rest of her exam's normal except for pedal edema, which seems to be stable over the last couple of months, maybe a little bit worse today. She came in complaining of edema, yeah.